Dr. Renee, welcome to the Life on Purpose podcast. I'm so grateful to have you here today. You have a really interesting story, and you have an area that I haven't really talked about on this podcast a whole lot. And that's kind of the burnout area, the libido area, all of that stuff that, we don't really as women kind of want to talk about. So again, welcome. Thank you for being here.
Thank you for having me. Yeah, as we were talking before we hit the record button, I have a history myself of a lot of things that I never knew existed, which is why I got into the field of functional medicine. But I am a double board certified doc now, but I was traditionally trained as an OBGYN. And, I thought I was living the dream life because we were in a suburb of New York City, but we had moved to the country. I had twins. And of course, I always say, what do I do when I move to the country? I get my dream horse, because that's what you do when you're in the country. I was a dairy farmer's daughter, and he never let me have a horse. So I waited till I was in my mid-30s to get my horse. And all was great until the day I fell off that horse. And that, I always say, that's where my story begins, because I felt like I had a pretty routine, mundane life, even though it was my great life.
Yeah.
But it was doing what I was supposed to do, which is practice OB/GYN, be a mom. And so that injury actually left me pretty much bedbound for about 6 months, out of work, and chronic back pain. And, I always say I was Humpty Dumpty that fell off the wall that couldn't be put back together again, because my injury was inoperable. And initially I was like, oh my goodness, thank God, because I never wanted my back ever to be operated on. As a OB, I saw all these horror stories with back injuries and back surgeries. And I'm like, oh, I never want that to happen. And here I am in the emergency room being told I have a broken back. And, that kind of ran out at about the 6-month mark. I said, just put me back together again, please, so I can go on with my life. And so they still couldn't, obviously, but I had other procedures done that got me at least off narcotics and back to work. And when I went back to OBGYN, I actually wasn't practicing my full scope of practice. I couldn't deliver anymore, and I couldn't operate because of the injury. So I sat in the clinic all day doing pap smears, which is really not why I trained so hard and, put all those years in. I really enjoyed the baby delivering and the operating, and really feeling like I changed a woman's life. And so I went on like this for a couple of years, but over the course of this time, what was this underlying symptoms aside from my back pain was the fact that I couldn't get out of bed in the morning. I definitely would hit a wall in the afternoon. I really wasn't motivated to do anything, exercise, eat well. I was just exhausted, quite frankly.
Yeah.
I lived on stimulants like coffee and sugar to get me through the day. And I was, gaining weight, did not have a libido, all of the things that, I did not feel comfortable in my own skin. And I think worst of all, the two worst things were that I didn't feel fulfilled in my job, and I didn't feel like a good mom, because here my twins were looking at me on the couch going, Mom, we want to do this, we want to do that. And I said, Mommy can't, she doesn't feel good. She's tired, her back hurts, whatever. One of the many things that I felt. So when I laid in bed one night with my husband and said, I just can't go on living like this. And I never had a thought up until then, but I just could not picture living my life feeling as awful as I felt. I went to my doctor and I said, I gave her all my symptoms, and she said, well, it sounds like depression. And being conventionally trained as an OBGYN, I said, yeah, I know I have to shove myself into a box of a diagnosis. I get it, but it just doesn't feel like depression. But looking at all my symptoms, that's what it's got to be. So I did shove myself into that little box. And of course, what comes with a box but a pill? So I started an antidepressant. And what happened on that medication is I had all of the side effects, and I still continue to have all my symptoms. So I went on a couple months and went back for my follow-up, and I said, it's not working. I'm having all of the side effects. I still feel awful. I still can't get out of bed in the morning. So what do regular docs do? Like I used to do, is if one medication doesn't work, you just try another. It's not like I have the wrong diagnosis. We have the wrong medication. And quite honestly, she didn't know what else could be going on with me. So we started a second medication. And same thing happened. All the side effects, no resolution of my symptoms. That's when I said, I've had enough. Like something is not right. So I abruptly stopped the antidepressant, and I do not recommend anyone out there, if you're listening, do that. Consult with your doctor. But I did consult with my doctor husband, and he's like, yeah, go off of it. Well, that wasn't the best thing, but I did go off of it. And now I was like, now what? And ironically, at the same time, I was put in contact with a functional medicine doc, and I didn't even know what that was.
So before you continue,
Yeah.
who, like, as a conventionally trained doctor, how did you even think to go that route? Like, who introduced you to this? How did this come about? Because it is not a well-known route, I guess, that a lot of us know to take or know that it's an option to take.
Well, it's kind of a funny story. It wasn't back in the day where everyone was online talking about this. It was, I actually, because I was so unfulfilled in my life career in medicine, I started selling anti-aging skincare because I wanted something fun to do in my life. Right. So I started that soon after my injury, probably within 6 months, just for something more challenging, because again, I just was not fulfilled. And a former friend of mine who grew up in the same town I did actually messaged me, and she said, hey, I had this really great functional medicine doc, they didn't call him holistic health, who does anti-aging. So it was the word anti-aging that got me hooked up with her. It was nothing on my part. It was nothing that I saw out there, which is why I'm here and you're here, right? We're here to like preach this from the rooftops, but it was the grace of God, the universe, whatever, that actually put her in my world. And it was the common ground of anti-aging skincare. Now, while I got on the phone with her, I was, all about saying, hey, you want to try my products? And she's like, no, I have my own, but hey, you want to try functional medicine? And I was like, what is that? So I remember that
goes
night
against everything I know to be true about medicine.
Yeah. Well, here I am on my computer in bed one night talking to her, and I'm Googling everything as she's talking. And I was like, oh, this is interesting, this functional medicine concept, because I totally didn't see this coming. And I just was on trying to sell her some skincare. And so she was like, and then she said, I know that you have some things going on. Tell me about it. And I told her. And she said, it's not depression. She goes, I think you have adrenal dysfunction, some sort of adrenal, we called it adrenal fatigue back then.
Yeah.
And I was like, whoa. And here I am Googling away as she's talking, right? And when I looked at all the symptoms, I'm like, oh my gosh, that is me. Why doesn't anyone else know about this? Why did I go to medical school, do a residency, been practicing for 15 years, and now I'm just finding out about this? So right then and there, and it's a funny story because the same night, my husband, I got on the phone with her and my computer, and he walked into the shower. And when he came out, I was like, I closed my computer, got off the phone, and I said, okay, so I have adrenal dysfunction. I'm going to go see this doctor. She's going to make sure to confirm the diagnosis with some blood work. And this is my treatment plan. It's not going to get better overnight, but okay, at least I have a name for how I'm feeling. And oh, by the way, I'm going back and doing a fellowship and joining her in practice in September.
How did that go over?
He goes, how long was I in the shower for? And in there, I said, I'm leaving my job at the hospital, just so I can, my point was, I thought at this point, I found the answer for me.
Yeah.
I had felt so helpless and hopeless for so long, to the point where I contemplated not living anymore. That, you're like rock bottom when that happens, right? I didn't have a plan, but just the thought of that coming in my head, it's like, oh my gosh, that really just made me think I have to do something. And to think that there is a way of getting healthy and feeling better that's at the tip of our fingers. And I always say it's simple. It's not easy, but it's simple.
Right.
And so, that's what got me into functional medicine. I did exactly what I told my husband that night I was going to do. And he's very supportive. And so I went back, I did my fellowship. And the thing is, once I started learning about functional medicine and holistic healing and the fact that our bodies are really meant to heal, the more disenamored I became with the way I was conventionally trained, with making a distinct diagnosis as opposed to just looking at all of the symptoms and trying to find one root cause.
Yeah.
And then after making that diagnosis, putting a pill on it. And I realized, gosh, not everything needs a pill. And so, combined with my feelings of that hopeless, helpless, like feeling like no one's there to help me, because at this point, when I had failed the second antidepressant, my doc was like, you're just going to have to live with this. Like, I don't know what else to do. And I love her. Don't get me wrong. She's wonderful. She's just like, I don't know what else this could be. And by this point also I'd flunked out of physical therapy. No one really wanted to take care of me anymore in
Yeah.
my world of medicine.
Right.
And here I always say, here I am. I'm in the medical world and I can't even get help.
And there's no answers. Right.
No answers. So it's not until this, again, this woman got put in my world and I was like, oh my gosh, like, wow, like there's this whole world of medicine out there that you can actually get healthy without, a distinct diagnosis necessarily. We kind of have an idea of what's going on, but then not necessarily needing medications. And with that being said, I'm not against medications. I just don't think we need it for every little symptom we have.
Well, I guess, and maybe this is a little harsh or maybe not, but how disillusioned do you become with how you were doing things before and how it can be done? And how frustrated do you get that, hey, we could be doing this completely differently because me as a physician cannot get help, cannot get answers, and I am being told, I'm sorry, I just don't know what it is, live with it.
Mm-hmm.
And
You know
what
what?
part of you is just like, okay, yeah, that's not an option for me.
Yeah, yeah. I was in that world, I always say ignorance is bliss. I didn't know any better when I was in that world. And when I was
Yeah,
going through my initial treatment, I didn't know any better. When I get to the other side and now I know better, number one, I can't practice in that setting anymore because I am
sure.
not of the belief that I, need to give a pill for everything. And the type of patient I was seeing was in that mentality of giving me the pill for the symptom, because that's how we've conditioned our society,
Yeah,
right?
right.
And, and I just shook my head going, wow, like all of this was right in front of me for all these years. I went to med school, I learned all this science and like, too bad there couldn't have been a marrying of the two of like a little bit of pills when necessary, needed antibiotics or like life-saving medications and a little bit of,
Yeah.
let's try to change your lifestyle, maybe strategic supplementation to get you feeling better. So, you
Right. The
know,
big question therein lies, why can't it be complementary? Why can't
y-
these two worlds
yeah,
complement one another? And it's better for the patient,
yeah, I
correct?
agree. Yeah.
Instead of saying,
Yep.
hey, okay, we're going to fit you in this box and give it a pill. If this pill doesn't work, I'm sorry, you're just going to have to
Yeah,
live with
I
it.
can definitely speak to that because back when I was OB/GYN, I would actually, where I currently live, I'm in a rural area, but I have a lot of people that live or spend their summers where I currently live, but then they live year round in New York City. So they'd
Mhm.
have a doctor down there prescribing something called bioidentical hormones. And I
Yeah.
recall a lot of these women coming to me saying, yes, can you do my exam, but can you also check blood work and make sure my levels are okay? And I remember thinking back then, like my ego was never so big to put another doctor down for how they were practicing.
Oh, sure.
I was always, and I like to say, I'm always humble enough to say, I don't know enough about those bioidentical hormones that you're
Hmm.
taking, like creams that your doctor kind of made for you.
Yeah.
I don't know how to follow hormone levels. All I know how to do is to check to see if you're in menopause or to see if you're ovulating, if you're trying to get pregnant. Those are the only two tests that I really know how to do.
Yeah.
I don't know how to check blood work to adjust your levels.
Hmm.
So actually, unfortunately, I have to defer that to your doc. And I understand now where they were coming from. Number one, they're trying to save some money by using a lab that their insurance is going to cover
Sure.
and to try to get some information. And on the converse, so a lot of docs I can actually speak from the conventional side is they think that if they didn't learn it in medical school, it doesn't exist. And we
Yeah.
did. The problem is it was so glossed over by making a diagnosis and then a course called pharmacology, which is
Yeah.
basically drugs. We have a lot to learn about drugs, the interactions, how they work, side effects, all of it. And because drugs can be very dangerous. And so there's a significant amount of time in medical school dedicated to learning about the drugs.
Yeah.
So a lot of docs, and I hate to say this, but they're on this ego trip of saying, well, if that's not how I practice, that's not how medicine's done. If that's not how I was trained.
Hmm.
And, I have to say nowadays though, some are opening their mind a little bit more.
Yeah.
Um, but that's not across the board because even when I was practicing in my office, I would have patients that were afraid to tell their doctors that they were working with me. They would get yelled at if they
Hmm.
were working with a functional medicine doc.
Yeah.
So a lot of times, while I want to be collaborative, because at the end of the day, it's not a competition. It's about getting the patient to feel better.
Yeah.
Maybe a little bit of this and a little bit of that. However, a lot of docs feel it's competitive, and I don't know why that's the case, but it is. And I would have some, for instance, I had this wonderful gentleman who had cancer, and he came to me because he wanted his last years of life to be his best. He had so much taken out of him for his cancer treatment, and he knew
Yeah.
there was a better way. And his doc didn't necessarily know how to do that. So he came to me, and she was very cooperative with our working together, like testosterone therapy and like, supplements and this and that. And so that was probably the most collaborative relationship I had.
Yeah.
And it's just sad because I saw how it could be. And it was just really sad that we couldn't have more of that going on. For instance, I have a lot of men that would be put on testosterone, and they go to the urologist, get off that stuff. It's making this.
Yeah.
And then they come back into me crying, feeling like they felt when they first came because they needed their testosterone, but their doctor, they were getting mixed messages, and there was not support for what we were trying to achieve for his quality of life.
Which is really interesting because there's obviously this gap that needs to be bridged,
Mhm.
because I think patients forget, and I was one of those, that we have a choice in how we
Mhm.
receive treatment.
Mhm.
And we also forget that we can go and say, okay, this feels better to me than this. How do we make this work?
Mhm.
And then it's up to the practitioner to either work with you or not. And if you
Mhm.
don't have a practitioner that's willing to work with what you want,
Mhm.
then we need to, we need to figure this out. And I think that it's important for people, and I guess you've been on both sides of this, to
Mhm.
understand that you have options.
You definitely
You
have
have you
options.
have options of how, and you have a say in how you want to go about this. But I think what's happening here is that there is a lack of understanding, or even a lack of education of, okay, what are those options, and how will they work for me?
Mhm.
Because we've had this kind of, like you said, this conditioning of, this is the only way that you can be treated, and that's the conventional way, which
Mhm.
in reality, that quote unquote conventional way is fairly new
Mhm.
compared to how we've done it, for
Mhm.
thousands of years before
Yeah.
that, which is kind of this whole body approach.
Yeah.
um so I appreciate, practitioners, doctors like you, who can say, okay, we can marry these two worlds,
Mhm.
and this is for the betterment of you, the
Mhm.
patient. And we're
Mhm.
going to look at everything, top to bottom, inside, outside, emotional, whatever. So, and that leads me back to this adrenal dysfunction.
Mhm.
So can you speak to that a little bit, of how, like, your emotional world, kind of this constant stress, this emotional stress, these, changes, everything that we do to ourselves on a daily basis, how does that manifest physically into adrenal dysfunction?
Yeah, we weren't meant to be stressed 24/7. I have nothing against acute stress. And that's your stress where you have an exam to take, you have a
Yeah.
talk to give, like that come and go stress. And that's what, have a test, you really study well, you retain it, you do well. Like
Yeah.
that is a good stressor. It's the stressor where, and it's different for everyone. It can be, everyone perceives stress as like just an emotional stressor. And that's the predominant stressor out there, especially now
Yeah.
with, you wake up in the morning worrying about something, or mindset talking negatively about yourself. Maybe you've gained weight over the past year. You don't feel comfortable in your skin. You a failure. You're not a good mom, whatever. You continue that through line throughout the whole day, maybe a little bit of different topics throughout the day, and then stressing about the kids at home. I get it.
Yeah.
Home, virtual schooling and this and that, having to balance, maybe working from home, doing all the things. And then you fall into bed at night, you maybe get a good night's sleep, maybe not, which is a, huge thing. A lot of people were not sleeping well over the past year. Maybe you're medicating with extra alcohol because of all the stress, and not eating as well because of the comfort foods that make us feel better. And then, over time, and everybody's different, your body starts not being able to keep up with that pace of stress. We weren't meant to deal with that. We were meant to, the tiger jumped out of the bush, our stress level, our cortisol level, which our stress hormone goes up. We either kill the tiger or the tiger kills us, and our stress level comes back down.
Yeah.
Our cortisol comes back down. That is like the acute stressors that we thrive on,
Hmm.
not this 24/7, 7 days a week, 365 a year stress that we are dealing with. So people's ability to deal with it varies too. We're all genetically different, and some people do thrive on stress until a certain point. For me personally, I was obviously thriving on stress because I was not sleeping every third night. I had twins, multiple sleepless nights, and the stress of delivering babies, all the things. And my event that put me over the edge was that fall.
Yeah.
So a lot of people, either it's one event, a traumatic event that just totally puts them into a tailspin, and all of a sudden they start having these symptoms, or it's just this chronic every day. And then, they don't even notice until one day they do notice, like, wow, I just can't do this anymore. I can't get out of bed.
Yeah.
And, I used to see this a lot when I started getting educated on these subjects after going through my own personal experience and still working at the hospital. I would see women coming in, mom of 5, single mom, working 3 jobs, coming into her doc just to get help, giving all the symptoms I just gave.
Yeah.
And she walks out with a antidepressant.
Right.
And that was the day that I knew I couldn't stay in that world of in the conventional world and try to do well by the patients, because I just knew that, number one, a lot of what I was doing and talking about wasn't accepted in my world of conventional care. But number two, like, that's not what she needed. She needed help. She needed to be validated that this is real. You have burnout.
Yeah.
Maybe she had a little depression. I'm not saying she doesn't, but you got to look at the other factors too. Like, she needs help. Where can we get help? Where can we, say no, set our boundaries, right? And where can you do a little self-care, get some sleep? And, I know that sounds so like, oh, but it's so crucial when you're trying to heal your body from this chronic stress. And
Right.
not only that, stress awareness, where is your stress coming from? Because I was just saying, a lot of it's emotional, but some could be physical. A lot of chronic diseases out there that got worse over the past year because of our lifestyle.
Yeah.
That's a huge stressor. I see a lot of people, when I check their blood work, indications that their body's super stressed, and they didn't have emotional stress. They had more chronic diseases that were really not doing well. So, you have to look at the whole picture of where is your stress? Is it more of a physical condition? Are you diabetic? Your sugars are out of control?
Right.
That's a huge stressor on their body. Or is it more emotional? Again, I work only with women now. And that's usually what I see as a predominant stressor is finances, kids, work. They're feeling trapped in their job, or they're not making enough money. And so it's always the awareness of what's stressing you out. What can we do about it? And I don't make it sound so trivial, like, oh, just go find another job or just find some money growing on a tree.
Right.
No, but you can only figure out a solution when you realize what the problem is and and you can only start working on your stress level if you start addressing what it is that's stressing you out, and have a plan.
What's really interesting, and I think back to my own diagnosis, I had a lot of things going on, but adrenal dysfunction was one of mine as well. And I remember the first time somebody said, okay, this is what's going on, that in itself was a stress reliever, because I had an answer. And then from that point on, okay, now I need a plan, and we can start to work on this. And so I think the validation of just someone saying, okay, this is what's going on, let's work on what's going on in your life, and we can work on that. What's going on in your body, and we can work on that. That in itself was just like, oh my gosh, I'm not crazy.
Yeah.
Because I think that oftentimes we're just like, I feel nuts. I feel like I'm going crazy. My doctor's telling me that I'm just depressed. I don't feel depressed. I don't think that's what it is. So let's talk about that. What are some of the physical symptoms of high cortisol or cortisol dysfunction?
Yeah, it could manifest as high cortisol in the beginning, which that's essentially not the time a lot of people start coming to me, because they're still
Like
feeling
high
very
or low.
yeah.
Yeah.
But what happens over time is your cortisol is supposed to be high in the morning to get you out of bed. Melatonin goes down, cortisol goes up. You're like, bing, wide awake with the sun coming up. That's what's supposed to happen. And then throughout the day, it's just this gradual decline to the point where it's low at night. Sun's coming down, it's getting dark, triggers our body to start making melatonin, our sleep chemical or sleep hormone. Then we go to sleep. Well, what happens after chronic stress is that the pattern becomes dysfunctional in that in my instance, and that's exactly, I would just want to sort of resonate with what you just said, that when I actually saw my saliva test, which is how my cortisol was measured, and I saw
Yeah.
how low it was in the morning, and the fact that it went up at night, because that's the other thing I didn't mention is I had a second wind at night,
Yeah.
and I was low throughout the day. I was like, oh my gosh, it's now all in my head. I'm not crazy.
Right.
And I literally I think I just sat there and cried like, oh my God, I have an answer. Just like you said. So
Yeah.
I was in that stage 2 whereby my cortisol wasn't as high in the morning, so I couldn't get out of bed. It would actually just remain, even go lower throughout the day. And then in the evening, I would start spiking up around 10 o'clock. And that was a picture called Wired Tired. And I was definitely manifesting with those symptoms of inability to get out of bed in the morning,
Right.
low all day to the point where I needed those. If you find yourself like just living on coffee, a pot of coffee a day, looking for those comfort foods, the sugars for your energy, not only energy, but comfort foods because you
Mhm.
are stressed. And then, potentially if you don't go to bed by 10 o'clock at night, you all of a sudden like, whoo, I can party. I'm ready to go. Like that's
Right.
stage 2. There are some people that it's across the board. They're exhausted all day. And that's usually like, and I can now see that in other people where they just can't, and I've seen it on cortisol curves, like they're just low throughout the whole day. It manifests in their energy and they're just like, they
Right.
just can't get up and go. Like they're all day. And it's just a struggle for them to put one foot in front of the other, let alone doing all of the other things that are going to actually help their bodies heal, which is eating real food as opposed to a lot of processed, packaged,
Processed.
sugary foods, which is what we turn to. You know, they're probably not sleeping well, which really their body needs to sleep,
Which is going to only heighten the problem.
Yeah.
Um, and then, again, like somebody, a physician not being able to say, hey, maybe what are you eating? And is this what you're eating putting fuel on the fire of what? So somebody like you, who has both the conventional and the functional side of things, would be like, okay, hey, we're going to look at this other area. This is what the answer is. This is what you have. This is what's going on. Now, what kind of fuel are you putting on
Yeah.
that fire? And let's
Yeah.
stop doing that, and
Yeah.
it sounds so simple. But it's almost, yeah, like you said, it's kind of a relief of, all right, let's, we've got answers
Yeah.
and now I know what to do and to stop doing and to move forward here.
Yeah.
Um,
And like I said before, it's simple, but it's not easy. And it's easy
no.
for us to talk about it. But, when you have, and again, we were both in that situation, right? Where, yeah, your doc says eat real foods. I'm like, okay, that's really hard. So what I find for a lot of women is this is where my strategic supplementation comes in, where I actually have to try to give them some supplements. And I always say I love supplements, but they can be like medications. Like you
Yeah.
can pour a ton of supplements on to cover up a problem and not get to the root cause. So I
Yeah.
strategically use them. Okay, if you have adrenal issues, let's maybe give you a B complex for a little more energy, right?
Right.
Let's maybe give you what they call an adrenal gland adaptogen, which is going to adapt your cortisol to where it needs to be.
Yeah.
Let's give you a little bit of a natural pump, a little
Hmm.
energy
Hmm.
boost to the point where you actually feel like making food. Like you don't feel
Yeah.
like going, because I was that person. I'd go to the cabinet. It would be so exhausting to think of making a salad. I would just go open up my cabinet and grab a bag of chips.
Right.
Right.
It's so
Does
much
that
easier. Yeah.
so much easier. Was that fueling my body? No, but was it allowing me to get back on that couch and lay down again? Absolutely.
Right.
So, we say a lot of these things and I get it, but sometimes you just have to, and there's baby steps, right? Like it's
Yeah.
just like, okay, swap out one unhealthy thing a day for better food. And it's just cumulative. It builds and healthier habits. You're going to find you starting to feel better. But just like you said, having that diagnosis and, oh my God, it's not in my head.
Right.
I can do something about it and having a little bit of a plan.
So, and I think you said something really important there is that, it's not easy. And again, we've been really conditioned to, hey, take this pill and have an immediate, you're supposed to
Mhm.
have an immediate effect, see an immediate reaction, good or bad. And sometimes you do, and sometimes you don't.
Yeah.
But we are used to looking to this like immediate relief.
Yeah.
And that is not how this kind of treatment works.
No.
It is hard work. And I've said this multiple times on this show is that it took you a long time to get here. It's going to take you a long time to get back. Not forever, but it's not going to be an immediate effect. But once you do start seeing the fruits of your labor, it's like, oh my gosh, what else can I do?
Mhm.
And you see that energy just to get better rise and rise and rise.
Yeah. And how many people, once it's not in your head, is like
Yeah.
that's part of the problem. And then, like I said, just giving a few little tweaks and, giving the women especially permission
Yeah.
to like take a nap if you need a nap. I'm not saying push through your day. Take a nap. Like
Yeah.
have grace on yourself. We're all super women trying to do it all. And at the end of the day, you can say you did it all, but you're not going to get a trophy. You're going to fall into bed at night, so
Yeah.
ask for help. Where can you ask for help? Because once again, once you have that diagnosis, oh, there is something going on. I give you permission to ask your
Right.
husband to help you around the house with groceries, making meals, doing dishes, helping the kids with homework,
Yeah.
whatever. It's just that, oh, I can ask for help. Okay.
You know what I've found interesting talking to a lot of clients over the last couple of years and talking to practitioners like yourself and kind of just being in this world is that I don't think we allow ourselves to be joyful.
Mm-mm.
There is kind of this lack of, you feel like you have to struggle through. And if I struggle through, then I've done a good job, but we forget that we can be peaceful and joyful too.
Mhm.
So being able to find that, and that can sometimes be a missing piece too. Where can we infuse joy into
Mhm.
our lives? Um, because even that has a physical effect on our bodies.
Mhm.
Just joy, just laughing, relaxing with friends, having a cup of coffee at a coffee shop with girlfriends and talking about nothing or everything. Um, it's such an important piece of our health that I think we don't often see or give enough credence to.
Yeah. And I think this year has been a huge, you just said something that sort of triggers something with me. Why I'm seeing this so much more now
Mhm.
is because women, we strive, we love connection.
Yeah.
We love connection with our significant others, with other women. And
Mhm.
we have lost that over the past year. We
Yeah.
have been unable to go out and have coffee with our friends, go out for a glass of wine,
Yeah.
just us with our girlfriends, not
Yeah.
being the mom, not being the wife. And so that has taken a huge toll on stress levels, because what has happened is that time we would have reserved for going out, we filled in with something else,
Yeah.
probably serving somebody else, like the
Yep.
kids, like the
Mhm.
husband, like work, right? And so
Right.
I have found a lot of women don't even know what brings them joy anymore, because they filled in all the nooks and crannies that we thought we were going to have with a pandemic.
Yeah.
Oh, we're all staying at home now. We're all not
Yeah.
going out. We have filled it in with a lot of other stuff
Right.
that now trying to resurface and come back out. It's like, now you got to, okay, what doesn't belong here? What can I give up so I can have a little me time? And it's
Sure.
not selfish to figure out what brings you joy. It's not selfish to have a half hour to yourself a day. Go take a walk.
Yeah.
I personally love to meditate, or read, but not everyone loves that. Go out and take a walk, go read a book, go sit
Yeah.
out in the sun, whatever you whatever you want, whatever is going to make you feel good.
Right. And how significant is burnout? Because I think burnout is it's such a thing across the board, both male and female, but you see it so much, I think, with women
Mhm.
and wearing all these hats. Not to say that men, don't wear a lot of hats as well and don't suffer from burnout as well, but how significant is that in the adrenal issues, in the libido issues, in the hormone imbalance issues?
I mean, it throws off everything, the simple burnout. And I love that fact that we can now say that, as opposed to adrenal issues or adrenal dysfunction, because
Yeah.
I think people get it. When we say burnout, they
Yeah.
get it. And it's interesting because I have seen more articles recently about burnout and like the conventional world. So like
Oh, that's
docs are
great.
getting
Yeah.
it. I don't know if they know how to work it up or anything, but like
Yeah.
I do find, for a lot of women, there could be more than one thing going on, like it was with you.
Yeah.
And, so there could be, but the problem is that burnout, that cortisol dysfunction actually sets in motion a lot of other female hormone
Yeah.
disruption, male hormone disruption, insulin issues, so sugar issues, obviously oxytocin issues, which is our cuddle love hormone, our connection hormone, that goes down when cortisol goes up.
Yeah.
Like we don't think as well. Our brain, actually areas of our brain start changing like size because of chronic stress,
Yeah.
gut dysfunction. Stress in and of itself can cause gut issues, gut health issues, but not only
Dysbiosis.
that,
Yeah.
then that trickle down of like what we're choosing to eat, will definitely trickle down to gut dysfunction. And so really burnout sets it all in libido, of course, because libido, when I address libido in women, it's not just when I do an entire talk on libido, it's not just like, okay, testosterone. Cause that's
Yeah.
usually that's what I thought it was as an OB. And actually I didn't even talk about it as an OB because I didn't really have that FDA approved medication for women. Pivot 180 to functional medicine, whereby I was asking every single woman about it. And I was still playing a lot with hormone replacement, but then I found out like, wow, this isn't working either.
Yeah.
So it's much more. So women, I hate to say it, ladies, we are complex. We have, men,
Yeah.
and not to just, not as a jab to men, but they are much more, they're simple. They have one main hormone. Yeah. They have a problem usually, in that sexual health department, you fix that hormone. Good. Ladies, we're not that simple. We have two main hormones, plus we have a little of their hormone, plus we have a lot of other hormones. So, it could be related to your gut. It could be related to your female hormones, your thyroid hormone, your insulin. It could be related to toxins, mindset, relationship, stress. Stress is huge. I think so, and again, it's impact on the female hormones and the gut and everything causes a low libido. So it is, and I find every woman I work with a low libido, which is again, a taboo topic that nobody talks about, which is why I'm talking about it. A through line for all of those women is stress, some degree of stress.
Right, right. And so how does that manifest physically? What are you seeing when somebody comes to you and they have all these issues going on and libido is one of them? This low libido, not wanting that physical connection with their partner, or not being capable of it even. Like what are you seeing physically happening in their bodies?
It varies. And here's the thing. When I talk about low libido, I always say it's just another symptom, right?
Oh,
Like
yeah.
it's always low libido and.
Yeah.
So I've had low libido and vaginal dryness, low libido and stress, low libido and autoimmune conditions, so like it's always the and. And, my approach to libido is not like, okay, use this lubricant or, I mean, again, vaginal dryness, that's a different story, right?
Sure.
And the interesting thing with that client is that come to find out when we improve the relationship communication, which is a huge thing that nobody ever thinks about, like, hello, got to talk about what you want, not in and out of the bedroom. When we talk about stress, how can your partner help you? Like, can they help with the kids? Can they help with the grocery? And, that just inherently will take something off of our plate. They can help. And that connection, like, oh gosh, you want to help me. Like you're listening to me. You want to help me. Boom, right there is that immediate, like, you do love me and appreciate me. And, might lead to something else,
Sure, right.
So just that there was a lot of like miscommunication I found with a lot of the clients I work with their couple, with their significant others, as far as expectations in the house and in the bedroom. So for instance, the one with the woman with the vaginal dryness, come to find out her husband was just fine with where their activity was at. And I was like, okay.
Wasn't.
She was, but she thought he wasn't. So when they talked and they're like, oh no, he's like, I'm good. Like, I really love how we cuddle on the couch and like, it doesn't always have to lead to the bedroom.
Gotcha.
Like,
so it came down to a communication issue.
Communication, and we corrected her other female issues, but like, it's like, just and you think it's a problem, but talk to him about it and talk to him about the fact that, this is something that you really want to improve. Yeah. But it takes a little bit of investigative work to get to the root cause of like, exactly why do I not feel like I want to do this all the time, or not even all the time. And when I say low libido, it's different for everyone. I always say if it's not where you want it to be, then we might have a problem. It might be something not necessarily a problem you want to look at. And, so when it's a libido issue, and I a lot of times have to figure out that and before we can, because that and will solve the many
I was
problems.
going to say, so it's kind of like this cascade effect of, maybe there's an imbalance here that's cascading down into all these other issues, libido being one of them, or, a hormone issue that's throwing everything out of whack, or, is it physical? Is it emotional? So all these things. So you're kind of like this well-rounded, hey, let's look at all of these areas and see how they're affecting you, which I find is really funny that, you wouldn't typically walk into your traditional OBGYN and say, and her ask you, are you guys talking? Are you, kind of digging into those other pieces? I think somebody would be like, whoa, hey, That's a little personal.
Yeah, I'm the only doc that talks about mindset and relationships because I find that's the through line with all of my clients is like there
Yeah.
is definitely a breakdown of communication on
Yeah.
both sides. And there is generally a mindset issue, like for
Yeah.
instance, if again, we're coming off a pandemic and a lot of women gained weight and lost control of their health and
And sometimes their household. I mean, if you think
oh
about just how many people were working from home with all of their
yeah.
and schooling from home and all their children. And yeah, I imagine the stress levels were through the roof for a
Yeah, and
lot
they
of
feel
people this
so
year.
out of control.
Yeah.
And so, if they don't feel comfortable in their body and their skin, but putting their shorts on and they're not quite fitting from last year, and then she doesn't want to get naked in front of her husband or boyfriend, it's
Partner.
like, that might be a problem with their
Yeah.
libido. Because if you don't want to, you have to have
Yeah.
the lights off and it has to be dark. And so like we talk about all of it. And
Yeah.
the mindset issue too with the negative self-talk and thoughts feed into that stress as well. So it is really this intertwined little web that is
Well,
weave
what's
that
really
we have to
interesting, and I don't know if I want this sounds really cheesy, and I don't even know if this is the right way to describe it, but it feels very customized. So your care is very customized to
oh
the
yeah.
individual person and what their individual needs, blocks, physiology, whatever is going on, it's very customized to that,
That's the
which I
beauty.
think we're all missing.
Yeah.
Um, None of us wants to be put in a box. I know, through my own experience, it was very kind of brushed off, put in a box. You're fine. If this doesn't work, I don't know what to do with you.
Mhm.
And that feels very disempowering. And I feel like women especially need to feel empowered in their own bodies and in their own health and taking control of their own health and asking for what they want, need in a partner, in a physician, in a practitioner, all of it.
Mhm.
All of it. And I don't think that we quite talk about that enough or allow ourselves that freedom to do so.
Mhm. Yeah. I do find, functional medicine is a lot harder than conventional.
Yeah.
Or
It's a puzzle a lot of
it's
the
a
time.
puzzle. It's, no, I always say no two women have the same treatment protocol. Everyone, it is completely personalized and individualized to what
Yeah.
is going on with you.
Mhm.
So when I come on and talk, there are a lot of variables. And I always hope that someone listening will get an aha moment like, oh, I'm not
Yeah.
talking to my partner. I'm not telling them what I want. Maybe that's the missing point, or piece. Stress. Oh, yeah, I have a lot of stress. I just have to be, so like they can take away some of the components and really evaluate because I always say you have to be an advocate for your own health.
Yeah.
There's a lot of information out there in the online world, and some of it's
Yeah.
good and some of it's not as good, but a woman can definitely start researching and start putting her puzzle pieces together and start, making her own little roadmap of how to get better. It just takes a little bit of consistency, one foot in front of the other, just keep moving
Right.
ahead. And yeah, I said after I left conventional medicine that you really just have to be your own advocate. And if, like you said, if you're not getting the answers you'd like, maybe you need to find a new doc that will work more with how you want to be cared for.
Exactly. Exactly. And I think we need to be reminded that that's okay.
That's okay.
It's
Mhm.
okay. It's okay if you want to do this differently. I find myself oftentimes defending myself and defending my choices and how
Mhm.
I treat my health, my family's health, et cetera, because it's very different than a lot of people around us. And it's constantly like in defense, in defense, in defense. Yet I'll get phone calls and say, "Hey, what herb were you using, for that one time?" Or what it was acupuncture. Did it work for such and such? Or, like all these questions. They want to know how these things are working, but it's kind of like, this is a whole different world. I don't know anything about it. Um, and that brings me to a question that's kind of, I don't know, controversial maybe. When we talk about quote unquote science, why do we feel like we can cherry pick science when there is science on both sides? There's the very hard science of traditional medicine, and there's also very hard science behind nutrition
Mhm.
and cortisol dysfunction and all this stuff. So why do we feel like science is only on one side?
Oh, pharmaceuticals, drug companies, big, I'm not like conspiracy theory and,
Oh gosh, and
but I have to
I would
say,
never I would never like, yeah, I would never think that about any practitioner on there, but I feel like it's so there's an attack on
yeah, because
nutrition.
vitamins don't make companies money,
Yeah.
make some supplement companies money, but like, and there's a lot, but the thing is, there's not a monopoly on supplements, like you can get a vitamin D
No,
from
and
several companies. You can get, so like it's just, and it's interesting because I do find a lot of the conventional docs. I don't even know what to call. I always call
yeah,
myself a former conventional doc because
yeah,
I think that a lot of eyes were open during the pandemic when we didn't have a pill for this thing that was killing all these people. And it's funny, I have a friend, he's in New Jersey, and he thinks like I do, but practices in the conventional world. And he's
yeah,
like, Renee, it's so funny. All these docs I work with can't even pronounce these supplements, but they're recommending them to the patients because now
yeah,
we're looking to the studies that are being done on supplements because we have nothing else.
right.
So I do think that when there's a pill for a problem, we kind of focus on does this pill work versus
Mhm.
this pill? That's the science that's out there
Yeah,
versus natural, like supplements and dietary changes and intermittent fasting and like
right.
lower carb or higher fat or whatever the dietary measures might be. Like we don't focus on that. We focus on the pill
A
and how did the pill work in
pharmaceutical.
a study.
The
Yeah.
science behind a pharmaceutical rather than the
Correct.
science behind vitamin D that is at every cellular function
Yeah.
possible.
Yeah.
Yeah, it's really interesting, and this whole past year has been kind of that for me. I'm like, "Well, wait a minute. There's also science over here. Like, why are we looking at this?" kind of thing. And I find it very frustrating that we can't, again, marry the two.
Yeah, and the only other thing in defense of my doctor friends, because again, I'm married to one who's still in that world, and
Yeah.
I was one, is that we don't have a whole lot of time to do a whole lot of research. Like we barely have enough time to
Yeah.
see all the patients that need to be seen and keep up with our requirements for practicing safe prescribing medication practice, like, so we have to keep up
Right.
with new medications coming out and the side effects and the indications. And this whole year, there was really no learning about anything else but how to deal and keep
Yeah.
people alive and feel better. But even aside from that, docs don't have a ton of time to do outside learning. They're doing their own requirements for their field. They're keeping up with the meds, the new drugs, because the drug reps are coming in talking about new medications that are coming out, the new and greatest,
Yeah.
diabetes medicine or whatever the case may be. And they don't and at the end of the day, when they go home and finish their charts and all the things, like they just want to
There's no more time.
no, they want to
Well,
spend a
then
little
how
time with
much
their
then let
family.
me ask you this, being in the conventional world and being married to somebody in the conventional world, how much of a disservice is this model to doctors? Because, and I will say this, I have a lot of really great traditional physicians in my life. Nobody wants to do their patients a disservice.
No.
They want to give their patients the best care. But you mentioned something earlier that there is not enough time. In the model that they are working in, there is just not enough time.
Yeah, there's not enough time. And here's the other little thing. When I realized, so I took an oath to do no harm.
Yeah.
And when I realized that what I had been doing, some of the medications I'd been prescribing are potentially harmful, I had to leave that world.
Yeah.
And people can't understand why I can't go back into that world and prescribe such hormones as Premarin, which I can't sleep at night
Mhm.
knowing that knowing what I know, that I prescribe that versus how I used to be. Ignorance is bliss. Like I said earlier, I didn't know. So all I was educated is a woman, hormone replacement, potentially Premarin, or
Right.
estrogen replacement. And a lot of the insurance companies, yeah, I want to cover that because it's dirt cheap. I'm going to make, that's from horses versus the more natural stuff that I actually prefer now.
Yeah.
And going back in that world, if I wanted to prescribe even the FDA approved more natural hormones, I got a lot of pushback from insurance companies because it's more expensive.
Yeah.
They will not, unless you fail one of their preferred medications, they're not going to allow you to use the more natural medications. So
And that
knowing,
has to be incredibly frustrating for these traditional doctors who just want to do the best for their patients and want choices in how they treat their patients.
So, I have to say that sometimes it's better not to know, because once you do
Yeah.
know, it's,
You can't unknow. Yeah.
I know, and then I can't sleep at night because, I had to leave that world. And
Yeah.
I still encountered it in my practice whereby, a lot of patients try to use as much as they can for functional medicine coverage. And there will still be insurance companies giving pushback
Yeah.
about more natural hormones, to the point where the poor patient had to come down to like, do I want to pay for the more natural hormone or go without? And because I was not prescribing the other,
Yeah,
so
yeah, and those are terrible choices for people to have to make, and especially, and that's another thing kind of on the functional side or the more holistic care, integrative medicine, et cetera, is that insurance companies are not covering these these, and I don't even want to call them treatments because they're not, but I mean, if you need supplements or you need to see a practitioner or you need blood work, it's difficult and it can add up. And I think that for those of us who choose this route, that is frustrating. That is really frustrating.
yeah, I like to say now too, I practice more proactive medicine than
Yeah.
reactive.
Right.
In my old life, I was just putting out the fires. It's so interesting because when I first entered this field and we would go out in our small little town to events with my husband, and people knew what we did, and they're like, "How is it in your house? Like you're more like natural, and he's more like
Traditional.
in the
Yeah.
hospital traditional."
Yeah.
And he always had a good point. He said, listen, when you come into the hospital, because he's a hospitalist, you have an infection perhaps that I have to make better, or you're dying and I have to get you better. Like he
Yeah.
said, either way, I'm going to do the measure that I have in my toolbox to get you better and out of the hospital. Once you get out of the hospital, you go work with her. So you don't come back into the hospital.
And that's a really interesting and an important distinction is that there's a difference between emergency care and chronic
Yeah.
condition care.
Yeah.
And obviously there's an important need for these emergency situations in these, traditional medicine and these technologies and et cetera for these emergent situations. But you're right. And he's right. Once you've got this chronic condition and you need to heal, where do you go?
Mhm.
People
Mhm.
like you who
Yeah.
can inside and out, we're going to work on getting you better. And then, and then I think it's also important for the patient to understand that from this point on, your health is in your own hands. We can put the fires out, but you know, I think we lack an education of how our bodies work.
Mhm.
I mean, I don't remember growing up really knowing how important food was,
Mhm.
exercise, sleep. You didn't think about it. You were go, 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 grab whatever you can. I didn't sleep a whole lot in college. And
Mhm.
then, you have kids and you don't sleep a whole lot then. But all of these things add up and they're super important. But we're not being educated on that. And my poor kids, they probably hate my guts. I'm constantly on them about, you know, eating their greens and eating their colors and how much sleep did you get and all this stuff. Like, mom, they're 13, 10, and almost 4, and they don't care about any of that stuff. But I'm doing my best to make sure that they do at some point remember that these things are important
I
because
agree.
that was not me.
No, my kids are the same way. And my son often says, Mom, can we just have some junk food in this house, please?
I know.
And I was like, what do you want? I'll go buy. It's not that but I just don't want you to have that I don't withhold it. I'll
Right.
once in a while, but like, that's not a staple in our
It's just
house.
not there. Yeah. Our kids know they, are always at neighbors' houses or whatever, going through their pantries and, sneaking stuff at friends' houses because they don't get it here on the regular. But yeah, it's the kind of this, it's important for me and it's important for me on this show. And it's important to bring people on like you who um, talk about the importance of proactive health instead of
Mhm.
reactive health. And that was perfectly said.
Yeah.
We need to be proactive in preventing chronic disease so that we're not just constantly putting out fires later
Yeah.
down the road.
And here's another thing I'd love to say, is a lot of times I will come in contact with women that have like near, I don't want to say near death experiences, but cancer diagnoses
Yeah.
before they have that wake up call to get better. And I
Right.
just want to empower your audience of like, don't let it get to that point. Like if
Yeah.
find that you're just, maybe you do have a couple conditions and like, it's never too late. I mean, and again, they're all success stories of the women I've talked to, but then they had to go extremes of like raw vegan and like, going to Mexico and getting ozone and all these things. Like, I don't want it to be that extreme
You're
for,
like, we need balance here.
yeah,
Yeah.
we need balance. So maybe, if you feel like you're going down that road of poorer health and just don't feel good. And that's the other thing. A lot of women just don't know how they feel. We're not in our bodies enough. Like, we're always on the go doing the next thing. Like, how do you feel? Like, really, how do you feel? How's your gut? Do you feel bloated? Do you feel tired? Do you feel like you run out of steam at the end of the day? Just become aware how you feel. And if you want to feel better, it's all at your fingertips. You totally can feel better. Everyone can do this.
Right. And I think that's an important distinction too, is that you don't have to accept if someone says, okay, well, there's nothing that I can do, I'm sorry. You don't have to accept that.
Yeah.
And I remember I had to get to a point where I was like, wow, I don't accept that this is going to be how I feel for the rest of my life. I was really young when I got my diagnoses. And I just remember thinking, yeah, that I can't do that. I don't accept that. And I think that it's important for women, men, anybody to say, okay, wow, there has to be another way. And there is. There are other ways. And to know that there are other ways.
Yep. That's what
And
we're here. We're here to preach it from the rooftops, right? That there are
right.
other ways, that you don't have to accept the normal when you don't feel like it's normal, or this is
The
just the way
status
it's going to have to
quo.
be. Mhm.
Yeah. Well, Dr. Renee, this has been an amazing conversation. How can people find you? What are the services that you offer? How can they work with you?
Oh, well, finding me, I am all across all social media. I am, as far as TikTok, I am everywhere. Just, again, Instagram, Facebook, TikTok, just YouTube, a podcast, just trying really just to get the information out there.
Yeah.
I just think our platforms, using them just to, like, if we can just, if one woman hears something today on this show that says, oh my gosh, like, maybe it's not in my head. There is hope for me.
Yeah.
Boom. Right. So I try to give as much free information as I can out there on all of my social media platforms. So
Mhm.
Dr. Renee Wellenstein across the board, Happy, Healthy, and Holistic with Dr. Renee at the podcast. And then my website, drrenewellenstein.com. I currently prefer to work with women one-on-one.
Mhm.
However, the applications to work with me have been a lot lately. So I'm currently trying to figure out other ways of serving women
Oh,
on a larger scale to help them get that transformation they're looking for without necessarily investing and working with me one-on-one. So,
right.
yeah, if
Fantastic.
you're
Well,
interested, a
I will
platform.
add all of those in the show notes so that people can find you. And this has been amazing. So thank you so much. And I hope that we get to talk on this show again about all of the other great things that you have going on.
I know we could talk forever, right?
I
This has been
know.
great. Thank you for having me.
Yes. Thank you so much.